Um, I chose to do my presentation on chapter 20, which is infectious diseases manifesting in the nervous system. Um, there are two parts of this. Part one isn't very long, part two is very long, so I only put the information that I thought was most relevant and most important. So, starting off is 20.1, which is the nervous system, its defenses, and normal biota. The nervous system has two parts: the central nervous system, which is the brain and the spinal cord, and the peripheral nervous system, which has the nerves that connect the central nervous system to the body. The nervous system has three main functions: sensory, which detects stimuli using sensory receptors; integrative, which processes and interprets the sensory input; and motor, which responds by activating muscles or glands. And the brain and spinal cord are protected by bone and has three layers called meninges. CSF, which is cerebrospinal fluid, is the meninges cushions, and it nourishes the brain and the spinal cord. Infection of the meninges is called meningitis. Um, the PNS is made of nerves and ganglia that transmit signals. Neurons communicate through synapses using neurotransmitters. The nervous system is protected by bones, CSF, which is the cerebrospinal fluid, and the blood-brain barrier. Um, this is an image that I found online. It's the one that I could find that relates to the nervous system the most because it shows what's in the nervous system, which is the brain, and then the spinal cord, and then the peripheral nerves. Um, Next is 20.2, which is infectious diseases manifesting in the nervous system. First is meningitis. There was also meningococcus, pneumococcus, valley fever, etc. But I just put the biggest ones on here. Meningitis is inflammation of the meninges, usually caused by bacteria or viruses. It can follow respiratory infections and is especially serious in newborns. To diagnose it, you would have to have a spinal tap to test your cerebrospinal fluid. And before meningitis is even confirmed, treatment can start, and it usually starts with broad spectrum antibiotics. Symptoms include photophobia, headache, painful or stiff neck, fever, and an increased number of white blood cells in the cerebrospinal fluid. Meningitis can manifest as acute or a chronic disease, and it is estimated that 4 out of 5 meningitis cases are caused by one of a wide variety of viruses. Neonatal and infant meningitis. It is usually a result of infection transmitted by the mother, either in utero, which is like during pregnancy, or during passage through the birth canal. Um, and as more premature babies survive, the rates increase because the condition is more likely in patients that have a immature immune system. And the two most common causes are the Streptococcus agalactiae and E. coli. There was also Chronobacter sakazaki, if I'm pronouncing that correctly. It was mentioned also. I just wanted to list that in here because I didn't actually put it in the PowerPoint itself. Meningoencephalitis. If you didn't know, encephalitis is inflammation of the brain, and there are two microorganisms that cause a distinct disease, which is known as the meningoencephalitis, and they are both amoebas. The Naegleria fowleri and Acanthamoebia are considered accidental parasites that invade the body only under unusual circumstances. Um, Acute encephalitis, it can present as acute or subacute. It is almost always caused by a viral infection. Signs and symptoms include behavior changes, confusion, decreased consciousness, and seizures. And the acyclovir therapy can save a life of a patient who has, I'm pretty sure it's who is HSV positive. It can save the life of the patient who is HSV positive. Um, Aboroviruses, they were also mentioned briefly, and they feed on the blood of the hosts. And the herpes simplex virus type 1 and 2, those were also mentioned, and they can cause encephalitis in newborns that were born to HSV positive mothers. Subacute encephalitis. When encephalitis symptoms take longer to show up and when the symptoms are less striking, it is known as subacute encephalitis. The most common cause is the protozoan toxoplasma. A second form can be caused by persistent measles virus as many as 7 to 15 years later after the initial infection. And prions can cause a condition called spongiform encephalopathy. Um, Toxoplasma gondii, if I'm pronouncing that correctly, was also mentioned, and it is a parasite that makes the infection serve and it makes it really severe, and most of the time it's often fatal. And it can attack at least 200 species of birds and mammals. And prions that are on here, they were mentioned, and they contain apparently no genetic material, but they cause TSCs, which are neurodegenerative diseases. Um, Next, we have the Zika virus disease. Um, Babies were born with abnormally small heads, and it came from a condition called microcephaly. And after a while, it was kind of determined that it was the Zika virus. Some people could have no symptoms at all, but if there are symptoms, they include skin rashes, conjunctivitis, muscle pain, joint pain, vision problems, involuntary movements, seizures, and irritability. To diagnose it, it does require PCR testing. The only prevention measure known is to avoid mosquitoes, and it originated in Africa, but it spread all over the world in 2016. The rabies virus, which I learned from this chapter, comes from bats more than anything, is a slow progressive zoonotic disease that is characterized by fatal encephalitis. The average incubation period is 1 to 2 months or more, depending on the wound site, its severity, and the inoculation dose. Signs of neurological involvement are agitation, disorientation, seizures, and twitching. Spasms in the neck and the pharyngeal muscles lead to severe pain upon swallowing, which can cause a fear of water, like the fear of water and drowning, because if you're not able to swallow it, it scares you. And there is an inactivated vaccine for the rabies virus. Poliomyelitis um, is an acute enteral infection of the spinal cord that can cause neuromuscular paralysis. Symptoms include fever, headache, nausea, sore throat, and myalgia. There is an inactivated vaccine available for this disease. Um, there is no treatment. The only thing that they can do is palliative and supportive care. Polio has been 99% eradicated, and the most common mode of transmission is the fecal oral route, but vehicle transmission is also, possible. Tetanus is a neuromuscular disease, and it's also known as lockjaw, and it's a disease of the jaw muscle. Symptoms include clenching of the jaw, extreme arching of the back, flexion of the arms, and extension of the legs. Death most often occurs due to paralysis of the respiratory muscles and respiratory arrest. And the only way to prevent the tetanus is by getting the tetanus toxoid immunization, which is recommended every 5 years. And when I had first heard it, it was like if you step on a nail or if you step on a can or anything and get a cut in your foot or anything like that, that you were required to get the tetanus shot to keep from it getting infected and causing the neuromuscular disease. Botulism, it's an intoxication associated with eating poorly preserved foods, although it can occur as a true infection with the bacterium. There are three types: foodborne, infant, and wound. It can be prevented by good food hygiene and a toxoid immunization. It can be treated with an antitoxin, penicillin G for the wound type, and supportive care. And there are over 150 cases annually. African sleeping sickness. It is caused by a member of the protozoan group known as hemoflagellates because of their propensity to live in the blood and the tissues of their human host. Symptoms can include fever, enlarged spleen, swollen lymph nodes, and joint pain. It can be prevented by vector control. And it can be treated either early, like when it's first found, or if it's found late. And if it is treated early, it's treated with Suramin or pentamidine. And if it's treated late, it is treated with eflornithine or melarsoprol. Thank you for watching this. I would appreciate any feedback that you could give. My email and my phone number are listed. So thank you for watching.